Hey guys, this podcast talks about jobs and different careers. We just want to let you know that we're not complete experts, so we may misrepresent some of these areas, and if so, we apologize. Please do not take advice from us from an official career choice standpoint. Rather, this is sharing our thoughts on the matter. Thanks.
The 50-minute rundown.
All right, everyone. Welcome to the 50-minute rundown with Steve and Nick.
Hey.
And basically, today we're going to be talking about different majors and how it's like to kind of go to college, be this type of major, and what you study, what's life like. With us, we have Nico. Nico, you want to introduce yourself?
Hi, yeah, my name's Nico Masala, and I am a fourth-year student. I switched from English as my first major to nursing a couple years ago, and just living the life of a nursing student at UC.
Well, what made you switch?
English was kind of a hobby for me, so I really liked to read and write. I didn't really like anything outside of that very much, and I didn't really want to teach. I always liked medicine. I just never knew if that was really the field I wanted to follow, and I met a nursing student actually at a camp. I volunteered at epilepsy camp for Cincinnati Children's, and the Cincinnati Epilepsy Foundation run a camp together. So one of the nurses from Children's was at this camp, and she was telling me all about nursing, and I just fell in love with it, and I decided to switch.
How hard was the switch?
It wasn't easy, especially since I was in English. So I really had nothing. I really had no classes to train. Right, exactly. So I had all my English out of the way. But so it was tough. I definitely knew that because I was switching, I was going to have a lot more work to do. And it was definitely interesting going from so many humanities classes to pretty hardcore science. But I really enjoyed the switch. I think it was really interesting, and different change of pace, kind of thing. So
this is your second year in nursing.
It's my second year in nursing. So I've got 2 years left to finish what is the BSN for nursing.
Okay, and do you know what you want to do after those 2 years?
I would definitely like to work at Children's Hospital.
Okay.
I'm really interested in pediatrics. I would like to go back to grad school. There's a degree, nurse practitioner degree. That's primarily what I'm interested in. I don't really know how that's going to look after 2 years. We'll see. I know they're switching the program to a doctorate.
Oh.
So I don't know when it's rumored to happen in 2015. I don't know if that's true or not. So
oh boy.
I'm just kind of hanging on. We'll see what happens, I guess.
Okay, got it. I guess the topic of this podcast is what it's like to be in each of our majors. So what's it like to be a nursing student? What do you guys study and what do you guys do?
It's busy. Primarily, we get our basic sciences out of the way the first year. Anatomy, chemistry, a lot of physiology. After that first year, you really start the nursing transition. So we'll have generally a couple classes, pharmacology, pathophysiology, which are still very much lecture-based. And then the rest of our classes are much more hands-on clinical stuff. So learning how to give injections, changing bed linens to, you name it, we do it. I think the most different thing about nursing is that because we have to take a state board examination at the end to get our registered nursing license, all our tests are styled after what's called the NCLEX, the board exam.
That makes sense. Yeah.
So the questions are very open ended. It's multiple choice, but one answer is more right than all the others. So it's definitely rough. So pretty much from the minute you get into nursing school, which is your second year, is really when you make the transfer to nursing school. All the questions get kind of twisted up and thrown at you, and it's rough, but it's definitely a lot of fun. It's very different. That's what most nursing students said, and I never believed them when I asked them. Well, the older nursing students, what's it like when after your first year? What's the actual nursing school like? And they just said, it's just kind of different.
Yeah.
So now it's very obvious why.
I think compared to any undergrad, nursing is probably the most unique in that you're like in the hospital. Like we're still all in the books and everything.
Right.
You guys actually get to interact with
patients. I agree, and I think I was talking to one of my professors the other day, and we were kind of talking about, the difference between, because nursing school and med school is often compared. And, med school, you have a lot of stuff thrown at you, still very, very busy, but at the same time, you're not in a clinical situation. Whereas nursing school, you have both the classes and a clinical situation. You're trying to combine both of them at the same time. So, it would be like co-oping, an engineering job and then going to school at the same time kind of thing. It's just kind of melding two different parts of your school life together.
Yeah, and for those who are not familiar with co-oping, that just means you kind of take almost a semester off and you work for a company in your respective majors. So Steve's a mechanical engineer. He's co-opted with mechanical engineering companies, and then he goes and returns back to school.
Yeah, and that was the whole advantage of the quarter system, and that's one of the few reasons I think Cincinnati had it for so long and why the rest of the state didn't. And so that's I'm kind of glad I went through the system while it was still quarters, because that gives you an equal mix, and like every 3 months you're going to go back and start learning different things to apply the next time you're out in the field.
Right, yeah. So maybe we'll switch to Steve just for a bit. So Steve's a mechanical engineer. Steve, why don't you tell us a little bit more about that? What is that? What do they do?
Yeah, there's 3 main pillars of mechanical engineering: thermodynamics, kinematics, and mechanics of solids. And so sort of all the classes branch out from that. I chose mechanical engineering. Originally, I was thinking aerospace just because I thought space was awesome. Things flying. And then I found out NASA actually hires more mechanical engineers than aerospace engineers. And I went to a summer camp in 2006, and the guy who talked about mechanical engineering actually wasn't that interesting, but just the just the facts. He said that if you get a mechanical engineering degree, you can go anywhere engineers are needed, because mechanical engineering was kind of like the original one that all others sprang out of.
Yeah, that's right. Yeah.
So I made the switch like 2 years. I had thought most of my life I was going to be an aerospace engineer, and then I switched right before.
But that switch was, I guess, a lot easier than Nico's switch, because you're, you're still
a few less fluid classes, okay.
So maybe, and so for those who don't know, I'm a biomedical engineering student. So me and Steve kind of shared a lot of similar classes at the beginning, like Calc 1, 2, 3, and Diff EQ. We call that, it's differential equations, we call it difficult equations. It's just really, really intense. Those are like the weeder classes that try to like kind of cut you down and throw you out. But if you stick through them, you find out that some of them weren't necessary.
Thankfully, in some cases.
Yes. And, I mean, it depends on what area you're going into. But, like Steve said, mechanical engineering, yeah, I agree, is more of a foundation for a lot of different disciplines. I've not met a project where there wasn't a mechanical engineer in it yet. So, they're definitely crucial. And they definitely play a role in almost every engineering project.
Yeah, so my issue right now is I have too many options.
we all feel really bad for Steve. Trying to cope with this.
I don't mean in direct job offers, but in terms of like finding my purpose in life, or finding like
what area you want to go into.
Yeah, like nursing. You have a general idea exactly what you want to do.
Yeah, one direction.
Whereas now it's very exciting, but we'll see.
Right. Yeah. Well, maybe one thing we could talk about are kind of like differences between your major and my major, because I think people might be inclined to go into like some medical like field.
Sure.
But we kind of do completely different things.
Definitely. Definitely different.
So yeah, yours is more of like what you would think if you're a patient going to the hospital, like
absolutely. It's completely, anything you think hospital, injections, medicine administration, checking your blood pressure, checking your lung sounds, all those hands-on things that you see on ER. Those are the things that nurses do. So in that aspect, it's very interesting. You're also, working with the patient primarily all of the time, which is great if you're a people person. I think that's really the kicker. Even between med school and biomed, it's much more patient interaction. All day, every day, it's going to be myself and my I don't know, several patients and, making sure they're okay, administering medication and stuff like that. So
you mentioned that, have you watched ER before?
I have, yeah,
or
of
Scrubs?
course. Yeah, definitely Scrubs.
What have you noticed to be the biggest difference between what TV portrays and what it's actually like there?
Well, it's definitely not as fun. No, but it's your days are definitely not as interesting maybe on the TV show levels. And there's definitely a lot more ethical issues that you don't really come across as often in a hospital setting. There's not as many plane crashes in the middle of New York City and thousands of people dying, but that's a great thing. So
right.
But those shows I think are funny just in the way of how they portray hospitals. I think the most interesting part of it is that a lot of people think, oh, medicine is so much fun, it's so interesting, the patients are all so friendly and they're just sick and they need your help. A lot of times it's not that. A lot of times it's grumpy, actually all of the time it's grumpy patients who really are sick and they don't feel like being there and they don't really want your help. So there's definitely that mix to it. So
I think one thing with physicians versus nurses is that physicians don't spend as much time with their patients because they have to cycle through so many.
Sure.
And whereas I think nurses get more time with their patients. Have you felt the effects of that?
Absolutely. I think one of the biggest things is because we're with our patients all the time and monitoring them, we have such a, better time trying to make a better diagnosis. The doctor might say, this patient has pneumonia. Well, that's great. What else is wrong with him? Mm-hmm. Throughout the day, we might, see something the doctor's not seeing. How is the medication working? How is this therapy working? Is this cough getting better? Is it getting worse? You talk to them about their financial life, their spiritual life, their home life, their family life. So you really kind of get a better picture of who the patient is, which realistically, it makes treating them so much easier. You get to know him. It's better than just he has an infection, give him this medication. That's great, but how else can we make this so much better that he can get out of this hospital sooner? Could he see his family? Does he need some help with paperwork and stuff like that? So I think that's probably one of the bigger differences.
I don't want to ask a more of a future question for you, but I think a big thing that a lot of people don't know about, including myself, is what is the major difference between a nurse practitioner and a doctor? What's the difference?
That's a really good question. One of the biggest differences is primarily what you can, prescribe to a patient. A nurse practitioner, for those of you who don't know, a nurse practitioner and a nurse, but the differences between them is a nurse can't actually make a medical diagnosis. They can make a nursing diagnosis, but they can't make a medical diagnosis. So
what's the difference between those?
Sure. So a medical diagnosis would be Stephen Bangs is in the hospital because he has pneumonia. It's a medical diagnosis. A nurse would say Stephen Bangs is in the hospital due to impaired gas exchange and shortness of breath. So you're not actually saying what is the problem. You're giving symptoms. Of the, right. Exactly.
Okay.
So with the nurse practitioner degree, it's 2 more years in graduate school, and they're now able to make a diagnosis.
Okay, so
a medical diagnosis.
Yeah, so nurses just with bachelors cannot make the medical diagnosis.
Exactly.
Nurse practitioners can, but they can also administer different medications.
They can. In certain states, I want to say it's most states now, save for a few here or there, you can administer and prescribe different types of medication. The list is different from a physician. I know it's
more limited.
It is much more limited. What's called Schedule 4 drugs. These are really, really high painkillers, opiates, and stuff like that. We cannot prescribe just because of addiction problems and stuff like that. Those are still primarily physicians are going to be prescribing those, but we can prescribe antibiotics. We can prescribe sleep medication. Any of those littler things that might help a person out.
Okay, got it. So. And you don't have to ask a doctor for that. It's just
Exactly, right.
You treat the more minor cases.
Exactly. We're going to treat the more minor cases. Primarily, nurse practitioners are found in clinicals. Or, I'm sorry, not clinicals. Clinics.
Yeah.
Or they're found in clinics. And they do work in some hospitals. Generally, if they're in a hospital, they're more of a charge nurse, more of a managerial position.
Got it. Okay. So basically, going into nursing, there's different levels that you can kind of stop at.
Yeah,
and
definitely.
each level, it's not unlike going to medical school where you're committed. Like you have
exactly.
to go through the
Exactly.
entire thing before you're actually
Right.
get to the.
No,
the
it's
end.
it's very true. And nursing, I kind of want to say it's almost more like what Steve was saying with mechanical engineering, is that it's such a broad, basic medical career. If you just want to have your bachelor's degree, you can work in absolutely any part of healthcare. You can work, pediatrics, you can work geriatrics, you can work in, clinics, wherever you want. And you can advance to a nurse practitioner degree, or if you're interested in research, you can get a doctorate and follow, whatever kind of research you're interested in. There's a lot of nurses that follow genetics as a research project. So it's definitely nice. It's a very broad area you can go into.
Wow. Okay. Yeah. Well, thanks for.
Yeah. Have you found yourself starting to self-diagnose at all, or have people started coming to you?
My family, every time something's wrong with them, it's the first thing is, Nico, I don't know what's wrong with me. I think my hand really hurts. I just tell them I have no idea either. I really don't. But no, it's funny. Day to day, just at the grocery store, hanging out at home, you can pick up on someone's not feeling well. You look at someone's rash on their arm, and you're like, oh, that is definitely poison ivy, or that's definitely psoriasis, or
I've seen this at least 100 times.
Exactly, it's funny. It's definitely funny, and definitely, it's a lot of fun at home. I have 4 younger brothers. And we're all living at home. I'm commuting from home to school, so anytime there's a cold or allergy or anything, it's always me pulling out my stethoscope and blood pressure cuff and checking them out and getting my practice in. So, but yeah, people love to ask me medical questions. It's a blast.
Yeah, that's great.
It's funny. I get not exactly the same thing, but whenever something goes wrong in the house, or whenever like a light bulb breaks, even that, my roommate would be like, "See, terrible engineering, just horrible."
Anytime someone's bike's broken, it's Steve,
right.
Can you fix this?
Well, that hasn't happened, but just blaming like the general engineering problems, and of course, almost everything's been touched by an engineer somewhere.
Sure,
so you'd be
sure.
like, "Your major did this."
Sure.
Yeah.
I'm sorry.
Now, when you said that didn't happen, you mean the fixing or the problem with the bike? I'm just kidding.
Plead the fifth.
But yeah, so maybe one thing we can talk about more, switching back to engineering, is for biomedical engineering versus mechanical engineering. So biomedical engineering is more of, you learn biology and chemistry, including organic. You have the pleasure of going through that, and even biochemistry. But at the same time, you're learning all those math equations and designing techniques, and even some programming languages. So basically, at the end, for me at least, my experience was I knew a little bit about everything, but I wasn't an expert in particularly one thing.
Right.
So like my capstone project, which is your final project you do at the end of your degree, surprisingly, mine was really good because it used like every discipline that I had worked with. It used biology, electrical engineering, designing, and programming as well. So all these things kind of synthesized together to make one fluid picture. So I think maybe one difference, one disadvantage of this versus like someone who's interested more in biology is you get like zero clinical experience. Right. I mean, the only maybe interaction you'd have with any sort of medical profession is actually talking to the physicians and saying, hey, we noticed that you use this tool in surgery. How would you like this improved? And we'll go back to the lab and redesign it so it fits your needs better.
That's interesting.
Yeah. So you're mainly talking to physicians, especially for like imaging or genetics programs as well. A lot of data mining for genetic programs. So you never really get to talk to any patients. So, now at the same time, you can definitely do other extracurricular activities like volunteer at the hospital and, expose yourself through different ways. But it's more of a you're kind of one specific guy. You're a biomedical engineer, and you are kind of dependent on like a mechanical engineer, electrical engineer, even a mathematician and a programmer. That's usually like the classic setup for a project. So you're like one superhero that has one ability. And you gotta like rely on all your friends to like save the day. So yeah.
That's funny.
Yeah.
Now, do you? So you're saying you're primarily designing things?
You're primarily designing things, yes. But a lot BME. Biomedical engineering is BME. BME is split mainly between research projects and then industry. So a lot of biomedical engineering research projects, for example, would be designing a nanoparticle to fight cancer cells.
Okay.
That's a classic research scenario. An industry scenario is developing a knife razor blade so it's like a little bit thinner so it can cut better in some heart surgery.
Okay.
That's more of like a industry type of. Industries are more on devices, whereas research projects are more like novel therapies that are coming out.
Okay. Are you pulled towards one or the other?
For me, yeah, I was just pure research.
Okay.
Yeah, so I'm a little bit biased towards that. Yeah, I mean, I did primarily research throughout my 4 years here, and I loved it. To me, it's an atmosphere where innovation is highly encouraged. And unlike in a company setting, I feel sometimes companies can restrict you because a deadline has to be reached and we have limited funds and you have to take these certain steps no matter what. Whereas in research, you kind of get a grant and you're on your own. You can do whatever you want, I mean, within certain limits with the money. And that encourages some people to go out on very like far-fetched limbs that end up working in the end. So now sometimes they don't work in the end, and then you're like, "Wow, we just wasted thousands of dollars." It's a little bit riskier, but because of it, and the other thing I should add too is with research, there's not like a deadline every other week or something. Sure. It's not very high pressured. It's only pressured maybe once a year when you're trying to apply for a grant or get a publication. So things are mainly relaxed. And as long as you pace yourself, usually things work out pretty well for you. Whereas I think in a company like 100 devices need to be checked every week, and you have to meet that deadline by the end of the week. And so I think that's more pressure on yourself.
So with biomedical engineering, for a nurse, it's pretty obvious where I'm going to end up working, in a hospital or a healthcare clinic or something like that. Where exactly, with research, are you, working for a university? Can you, work on your own?
There's probably like three primary end routes. Well, I should say for biomedical engineering. The first one is you just graduate with your biomedical engineering degree and you work for a company. Okay. All right. So you'll be doing maybe improving a cauterization tool. Another route is you do a master's or a PhD, and then you end up working for the company. So that you end up, kind of going to the same spot but different positions. So that's maybe one area. Another area is you end up doing a PhD and you go into research. So you do biomedical engineering research at a university, and you become a professor in biomedical engineering. Okay. The third route, which I'm taking, is go to medical school. So that one is usually geared towards the people who have done research in their biomedical engineering career, because that research is easily translated to medical research as well. Sure. So those are the three routes you can take. I feel sorry for Steve, because for me it's very defined. Like you have this option, or this option. But with Steve, there's so many choices to pick from that it's a nightmare. Right?
Thank you for
So, Steve, are you pulled towards any one mechanical engineering field?
I'm going through a process now where I'm really looking into myself and trying to examine why I why I got into engineering
Okay.
and what particular aspects of it. I think engineering was definitely the right choice for me.
Sure.
In terms of the way I approach problems, and I had amazing co-op experiences. So I don't want to say one way or the other right now,
Sure.
but yeah.
Yeah, I think one thing we should point out too is with Steve's mechanical engineering is that there's just so many specialties you can go into. Like, you could be working on a NASA rocket, or you could be working on building like some machine assembly line,
Right.
or improving the latest robot. Like, there's so many mechanical. I mean, almost every engineering device uses some sort of mechanics in it. So I can understand why Steve is so indecisive about it, because you want to make the right choice.
I'm just being really careful now. I'm laying out the groundwork so I can start closing doors efficiently and not have to like look back. So I'm not like lost. I'm just carefully narrowing it down.
Now, how easy is it, for nursing, it's very easy to switch. Let's say I don't like pediatrics in 2 or 3 years,
Right.
and I say I want to go into geriatrics, well, I just go right in.
Right.
Because there's no real stopping me. How easy is it for you to switch from, let's say you're working on that NASA rocket, and you're like, I don't want to do this, I want to build, assembly lines.
Right.
How easy is that for you to switch?
In terms of like a full-time job, I don't know how that would be a couple years into it, but in terms of co-ops, my co-ops were completely different. My first one was finite element analysis. So this was like looking at jet engine components and seeing how they will structurally react to impacts and various pressures and forces. And my next job was data analysis, so it was strictly researching different ways to model blood pressure and affecting factors. And so I think a mechanical engineering degree just shows that, I think most degrees are this way, but it just shows you're able to learn and that you're able to take on a variety of tasks.
Sure.
So I think there is some fluidity there.
Yeah, I would also say the same thing for biomedical engineering. Engineering is like known for at least your bachelor's. It's learning how to learn.
Sure.
And so that usually translates very well into different fields. There's a classic joke in biomedical engineering. I don't know if you have it, Steve, like about Fourier transforms. But yeah, anyways, the peak of BME mathematics, at least, is the Fourier transform, and if you know how to do that, you're usually set to do any mathematical challenges that come your way. And the funny thing is this transform, which is like this mathematical technique of analyzing waves, is actually applied throughout many, many, many devices. So it's kind of ironic that the toughest thing in BME is used for everything. So, yeah. Yeah, I mean, one thing we could do is kind of go around and maybe give an example of one concept that you guys have, like, learned. And that would kind of illustrate what it's like to be each type of student that we are.
Sure.
Do you want to go first? Do you have an example?
Yeah, I would say in nursing now, the big word is holistic.
Okay.
Holistic approach. And basically, at least I would say most major universities with nursing colleges, they tend to push this idea of, holistic medicine, whereas you're not only treating the patient for their symptoms, you're also treating the patient, like I was saying earlier, you're getting to know your patient. How can they heal better? How can we make this a better experience for them so they can get out of this hospital and hopefully not have to come back? So it is a holistic approach, as in, are they financially able to pay for their hospital visit? And if not, how can we help them? Maybe get a social service worker. Do they miss their family? Do they miss their family, or do they wish they had certain types of food that they don't get at the hospital? Those are certain things that we definitely push at the College of Nursing, and I think that definitely separates us from most other places. I think it's part of our critical thinking. You're saying biomed and engineering. You both have. It's how do we learn? Are we capable of learning different types of things and using all of those different types of things? And for nursing, it is. It's not only are we using our sciences, are we using our clinical skill backgrounds, but are we using our just critical thinking in general of of thinking in terms of the patient and their family and how can we improve their health. So I think that would probably be...
Wow, yeah, that's a really good example. Yeah, that's... So how do they teach you something like this?
Well, it's not easy. I think they kind of try to mix it in every single class I've taken. For instance, this year, I took a pathophysiology and pharmacology, and pathophysiology is dealing with the anatomy of the body and how diseases affect it. So through that, we're looking at diseases, we're looking at the body, but we're looking at also, who is this patient? Is it a male or female? How old are they? What is their ethnic background? Do they have genetic dispositions towards a medication or towards a disease? And that's our holistic approach, as in, we might look at them and say, oh, you have hemochromatosis, which is, a iron disorder, iron deficiency disorder. So, we're looking at that, but then we're saying, okay, they have that. Are they genetically disposed to it? Are they Caucasian? Do they have an Irish descent for whatever reason? There's a lot of, Irish, Caucasian, male, female persons that suffer from this disease. So those are the little things, and in every class we'll kind of break it down. That was pathophysiology. In pharmacology, it might be, is our patient capable of paying for these medications? A lot of these, chemo is very expensive. For cancer, it's very, very expensive. Are these patients capable of paying for it? Are they stressed out? Stress might lead them to, a worse health state than they were originally in. So, which is probably very true for cancer. So those are the little things that we look at and we break down in every single class, and it definitely helps you walk into the hospital and you're seeing your patient. You see on paper that they have pneumonia or they have a terrible infection in their arm or whatever, but you're looking past that and saying, okay, well, who is our patient? Who is their family? What kind of job do they have? So I think that's really where it kind of, gets that critical thinking involved.
Yeah, definitely. I think a lot of people at first go would just be like focused on the arm and wouldn't think about anything else. Sure. So it's pretty interesting to hear that, because it's a lot of it. You would think what you're doing. You'd be like, yes, well, clearly the problem's here, so clearly, we're going to find a solution. But in reality, it can be something, totally in the opposite part of your body that is the cause. So, that is really interesting.
I was trying to cycle through the different projects I've worked on to come up with a good one. One, we had a motor. I don't remember all the parameters, but we had this motor suspended, and it had something to do with calculating the strength that the cables would withstand. So what type of material, what thickness, how long do we want it suspended? And so this motor would generate different frequencies depending on how it's running. And so we'd have to do free body diagrams for each part. We'd have to write governing equations, transform those governing equations into a script for MATLAB, and then just play with different parameters so we could get a balance between cost and practicality and
Can you run through real quick for us what a free body diagram and what MATLAB is?
Yeah, free body diagram, essentially when you're looking at a system, there's all these different parts to it. Free body diagram, you want to just take one part at a time, and you want to represent everything else by a force or constraint on the free body diagram. And that allows you, that's something you need to do, because if you don't, it's easy to just forget about some factor, or if you can't identify what something is doing to that part, then your calculations aren't going to be very helpful.
Yeah.
And your different parts obviously have to match. So if you have a 500-pound force going one direction, you have to have the equivalent force on the attached part. And then MATLAB, it's a really nice programming interface that it's not like a hardcore language, but it has a lot of built-in toolboxes and additional features that are really helpful. But you can also do some really cool basic things with it if you just know a little bit of code.
All right, thanks. Yeah, just because I know for a lot of people that's not. Those aren't words I would know before entering college.
Yeah,
so
I just learned a lot about
it
there.
Well, nice.
So yeah, I think maybe one BME project, this is kind of a big one, but it's pretty popular, so a lot of people know about it, is Fold It, the video game. I don't know if you've heard of it before.
I don't think I have. No.
Yeah, okay, so maybe some background before I get into the video game. For the past, maybe 70 years, when we tried to describe or find drugs to cure a common illness, it was more of a random sampling type of technique, like a trial and error, where it was, oh, does this drug work? Well, apparently not. He died. Does this drug work? It wasn't a very logical process because we didn't have any sort of way to logically deduce what compound would be the best compound or a best solution. Like when we discovered penicillin, we didn't say, oh, I know, we need something that will only target bacteria and not cells. Let me go build that in the laboratory. It was more of an accident that we found it. And so what Fold It is trying to do is actually introduce logic into the drug discovery process. And what it does is it's a video game that people can play online on their computers. And the goal is you have to fold a protein into a certain shape.
Okay.
And these proteins are very important because, as you know, they're like the body's workhorses. They kind of do everything around the body. And projects like these incorporate thousands of people working at the same time. And they would win points by folding proteins together better than supercomputers. They've done a lot of advances, but not just Fold It, but other projects are also looking at the idea of building your own drugs or enfolding in your own protein so that it attaches or latches on to a virus, for example. So you see what the virus looks like, and you build a protein that will attach to the virus and destroy it. That more logical process is it's like a biomedical engineering project. And we're hoping it will transform the trial and error drug discovery process to more of a logical, all right, you have this virus because we sequenced its DNA, and we know how that folds together, and we know how the protein shell that virus is, so maybe we can build another protein to attack that virus. So, it's very exciting, and it's ironic that it's the general population, people just sitting at their computers and stuff that are doing the work. It's pretty amazing. So that's basically one BME project, but there's many others that span across different areas as well.
It's funny you mentioned the idea of building shapes and viruses and all these things. Everything you're saying totally comes back to my career. As a nurse, I'm absolutely waiting for Nick here to create this amazing folded protein that will attack individual viruses, and that's just fantastic news. So I'm glad that's what you guys are doing.
Yeah, well, I'm personally not doing that. I mean, that's just one project. Sure. But it's one of the most famous projects because of how good it's going.
Sure, absolutely, yeah.
I could give maybe another example. This is on another end of the spectrum, and that is organogenesis with 3D printing. So those are two big words, but basically the idea is right now is transplants are really tough because there's a shortage of them, and even if you do get the transplant in time, you have to take a load of rejection drugs, immunosuppressants, so that your newly transplanted organ doesn't get rejected by your own body. So to kind of combat all of that, what a lot of BMEs are thinking of doing is taking your cells. I don't want to say they're exactly stem cells. They're called iPS cells,
sure.
But and there's mesenchymal stem cells as well. There are different types of stem cells, but basically we're thinking of taking your stem cells and reculturing it to maybe that pancreas that's going bad in you. So suppose you have a very severe case of pancreatic cancer. You have to take your pancreas out, but you can't survive without your pancreas. You could maybe grow a new one and then put that one back in. and you would use these stem cells, you would culture them into pancreatic cells, and then you would use what we call a 3D printer. And so what that does is it prints layer by layer what the object is supposed to be. And they do this now with like cups and things like that, and models. But we're now thinking about doing that with organs. And so since the organ was made of your own cells, your body won't reject it. And additionally, it's printed to whatever size you need it to be. So
perfect.
Yeah, it'll fit right in. Yeah. So we got about 10 minutes left. So yeah, I just let you guys know. But I don't know if you guys had any other thoughts or other projects that you guys liked about your majors.
I'm trying to think of one here. I think one of the biggest, again, along with what Nick is saying, is nurses are, it's not like we're waiting around for these drugs, but we're definitely interested in this. What Nick is almost talking about is individualized medicine.
Yeah.
Individualized pharmacology. Every person is different. Every person has a different ethnic background, weight, height, body structure. So, like Nick was saying, a while ago, and still on today, we're doing these clinical trials on animals and humans and hoping that they work. But, I think an interesting career for nursing, a lot of it is hands-on. I think that's definitely primarily what nurses are looking at is a hands-on approach to medicine and helping the patient. But like I was saying earlier, if you were to get a doctorate in nursing and follow let's say a genetics or a pharmacogenetics course, and that's kind of a big word too, but basically it's just looking at medicine and how it affects each individual person and their genetics. And I had a professor last semester, and she got her doctorate, and she went into genetic testing and research, and I mean it's just amazing. It's very far fetched for me because I'm not really interested in the research side of things. But the people who are just amazing. They're coming up with these amazing ideas. Testing the wildest things. Just pulling this research up from amazing places. And it's very interesting to see that, and she'll probably more than likely have all this research go to a pharmacologist, go to a BME, and it's all pretty neat. It's all kind of working together, and that's certainly a field in nursing that is very hot right now is the research side of things, especially because you can work with the patient still. She worked. My professor worked at Children's Hospital. She was working on a cardiac floor and just doing research specifically on one genetic variance that affected the cardiac cycle. So it was producing dysrhythmias, which is just a different beat. Your heart rate's a little offbeat here. But that was her job, and she met thousands and thousands of patients who had this problem, and she developed research, and so she got to spend time with them, get to know them, their family life, who they were, but at the same time collect research and kind of get these grants and go on her own way, and it's amazing. And she's definitely part of that whole cycle, as well as the BMEs and pharmacologists, is trying to find a better way to treat the human body, and certainly individually would be best.
Yeah. So. Do you mind, just for our listeners who don't know, do you mind explaining genetic variance, that concept?
Sure. So genetic variance, kind of just a big word. If I had to break it down, I guess it's within our bodies, every single person has these, like you were saying, the proteins, these workhorses. And genetic variance generally is a piece of your DNA is mutated along the lines of, it could have been in birth, could have been before birth, but there's a change in your sequence, and sometimes it's minor, and you have absolutely no problems at all. You would never see it outwardly, and other times you would see it outwardly. It's a big change. You have all these what are bases, and they're being changed in your DNA, so it's reading differently.
Yeah.
I'm sure you know a lot about this. But so it's reading differently, and all of a sudden now you're coming up with a problem. These proteins have changed, and your body's building proteins that are maybe shaped differently. So they're maybe not able to attach to certain things, or not able to carry certain things in your body. and then all of a sudden you're having problems. So that can affect you with, for instance, the cardiac. You have dysrhythmias, or maybe you have a likelihood of developing cancer, or poor bone development. It can really affect everything.
Yeah.
Truly. Every genetic variance in every single population is very different. But yeah, so it's very interesting.
Okay.
Yeah, just one more comment about engineering. If people are considering it, a lot of people get recommended by their guidance counselor to go into engineering just because they're good at math and science and they really don't know what it's about.
And so little do they know.
So subsequently, the dropout rate in mechanical engineering, like 2/3 of the people will be gone. So
wow.
Really?
There was like 150 of us freshman year, and either they found out they were dappers, or they transferred schools, or it just wasn't for them. And so we're down to like the 60s now. So it's kind of, it's one thing where it looks at the person to your left, looks at the person to your right. Only one of you three is going to be there.
Right.
Until the very end, yeah.
That's funny.
But I would just say, if you do get into engineering and you're not sure, I would at least wait until co-op, because that's when you're going to actually see what engineers do. The school isn't a great reflection of that. And after that, you'll be able to see like the work-life balance, and also know what to pay attention to in school the next round through. So.
Yeah. Also, one thing I would say is, I think a lot of people, when they hear engineering, they think like guy world, like it's just all guys. For some majors, some engineering majors, that is pretty true. But what I would say though is, in BME, Biomedical Engineering, that's not true. I think the class is like 50-50. And honestly, I think the girls, the women end up doing a lot better than the guys. So I think if you are like concerned about that factor, don't be, because there's definitely, it's not like they're exclusive or something like that. It's not like they're going to shun you or something like that. So
I think BMEs are a totally different breed, though. Like,
breed.
where most engineers are really introverted, or at least that's the stereotype. Whereas BMEs, you guys are just like social animals, I think.
Yeah, I don't know. But yeah,
for mechanical engineers, I think there were maybe 10 women in our class now. So
yeah.
You guys should become nurses.
Yeah. Well, thanks for listening. We really appreciate it. Unfortunately, we got to get going right now. But we do appreciate your time, and hopefully this will kind of give you an idea of what major you would like to find out more information about in college. So thanks again for being with us. You guys just want to say bye real quick? Yeah, see ya.
Thanks very much. Thank you guys.
All right, have a good one.